We are back here on Healthy Living with Joel Taylor. Again, it's great to see you and so many things going on. During the break, we're talking about, gosh, how do we even limit this? Because you do have a lot of things going on. Again, we talk about everything being medical center now, which is really comprehensive. You've got a lot of new specialties and docs that you're introducing already. Can you share? You shared a little bit about the orthopedic surgeons.
Yes, ma'am.
But you've got other new folks coming in, other specialties.
So Dr. Nebuluk joined us. He's an infectious disease
First
physician.
time you've had a doc like that in how long?
6-7 years. So
wow.
to have someone of his skill set and specialty in our area is truly remarkable. So he's seeing obviously patients in the hospital, but also will have an outpatient practice. He's been a great addition and something as we work to really increase the types of services we're offering is a foundational member of those care teams, and excited to have him here for sure.
One of the things that I've always been impressed with, and you said is never going to change, is sort of the integrative and collaborative nature. My experience and the experience, from the folks that I've talked to have been that there's a lot of integration, there's a lot of talking, a lot of communication between the different specialties. And I would think that would provide a continuity of care that's pretty impressive.
It is, and it's true at most all medical centers and hospitals. But I would say one thing that makes Coastal Carolina and Hilton Head Medical Center really remarkable is these are physicians that could work anywhere in the world.
100%, correct.
They choose to live here because we live in an amazing area. And so they bring with them really high expectations. They bring high expectations of how they want communication,
correct.
how they want care delivered, how they want their patients treated. And so part of my job is just trying to meet those expectations.
Well, and now with Novant, you said it, now the patients can also enjoy the experience because everything is sort of wrapped up beautifully now.
So we will, so the team here is working pretty diligently because we will change our electronic health record. So the medical record system will change February of next year, actually mid-January of next year. So there's a lot of background work going on today that actually, Debbie, will very much improve what you just referenced. That communication across team members and nurses and physicians. Epic is the premier electronic health record. And so Novant Health, it's the standard in North Carolina. They're bringing it here. And it's one more investment in ensuring that the patient's experience and care meets expectations.
One of the things that I think is really impressive with talking to you and talking to all the folks around you when it comes to Novant is how much they want to embrace the local community. And they want to make sure from a partnership point of view, a patient point of view, that's how they're viewed. Like you said, you've always had top quality physicians because it's a great place to live.
Yeah.
But how is Novant is shifting that? What will that look like for me?
Great question. So I think what people will see and feel now as a not-for-profit is an investment in the facility, but also a reinvestment in the community. And so it's partnerships with some folks that we have had existing partnerships with. Bluffton Self-Help, staying connected out in Sun City. But it's new partnerships. Last fall, we made $1 million donation to the Coastal Community Development Corporation about workforce housing.
Got it.
And this year we are sponsoring the Heritage. We've been the medical sponsor at the Heritage for quite a while, but we've increased our sponsorship and the visibility. That team does a remarkable job, and it's such an impactful event for the community, so we want to be a part. So it's the opportunity to be much more present in the community.
And I'll give you
really
an anecdote on the being present. Coldest day of the year this year, the chamber had their 5K, right?
Yes.
I was there, Adam was there, a lot of us were there. We had the best time and the feedback was amazing. We were
kudos to you all for weathering the.
But just that presence of Novant, it really made it fun, and we all felt connected. We all knew each other. It was again just a little teeny thing.
I love it.
But it was kind of nice to see that too.
And for me as a leader to be able to represent the team and for us to be visible as as a health system out there is very rewarding.
And you are going to be, you have a foundation, a brand new foundation that we're going to be hearing more about as time goes on.
Yes, hired our first chief philanthropy
There you go.
officer.
Here.
Thank you. And Nancy joined us 7 weeks ago.
Okay.
And is out and starting to set up the Novant Health Foundation in South Carolina, starting right here in Hilton Head, to again give people an opportunity to connect with us.
If people are interested in knowing more, can we guide them to the website? Because I know that's always up to date, always new fun things. There's a pickleball tournament happening in April. There's all kinds of goodies happening that you all might want to know about.
Yes, the NovantHealth.org is the company's website, and we have a distinct page. I would say in all of our rebranding and marketing efforts, that's part of part of that as well. So people are certainly welcome or happy for them to reach out to me directly.
I love that. Thank you for joining us here on Healthy Living.
Yes,
Thank
ma'am.
all of you for joining us here. Have a safe and healthy week. Bye-bye now.